everyone, this is Chantel back with another educational video, and today I'm going to show you how to perform a venipuncture procedure. So first thing you want to do is you want to review your doctor's order or requisition to see what tubes that you need to draw, what test is ordered on the patient, and then you want to verify and confirm. So you're going to ask the patient to state their full name and spell their last name and also give you their date of birth. You're going to compare that with the armband if they have an armband on or a driver's license. Once you do that and you confirm, then you're going to go ahead and wash your hands. And I already set up my supplies. I do recommend that you set up your supplies because once you tie the tourniquet on, you only have 1 minute to leave that tourniquet on. So I have my needle, which is already attached to the adapter. I have my tubes, I have my alcohol, and I have my gauze and my tourniquet. And then I also have a sharps container that's nearby. So I'm gonna go ahead and don gloves. And this is the time you can ask your patient if they have any allergies, if they're on any aspirins or blood thinners, and are they fasting. So I'm going to tie the tourniquet, and we always tie our tourniquet about 3 inches above the antecubital area, which is basically the bend of the elbow. So I'm gonna tie my tourniquet. And you want your tourniquet to be nice and tight, so that way it helps to pop up the vein. What I'm doing now is I'm palpating the patient's vein. You can ask your patient to make a nice tight fist for you if you like. And then I'm feeling for a good vein. Once I find one, I'm gonna go ahead and cleanse the site. When we cleanse the site, we wanna cleanse inner to outer, and that's wiping the dirt away from the site. I'm gonna grab my needle. We hold our adapter, 2 fingers at the bottom, thumb at the top, pull the safety device back, expose our needle, and we always wanna make sure that the bevel is up. Once I locate that, I'm gonna go ahead and pull the skin back, insert my needle at a 30-degree angle, and then go ahead and pop my tubes on. And then there we go. I am popping my tubes on in the correct order as well. Go ahead and release your tourniquet. Invert the tubes to make sure that you mix that anticoagulant with the blood. Cover over the site with your gauze, but do not press because there is a needle inside that patient's vein and you don't want to press down. Pull out fast and then press down. And then make sure you lock your needle. I always say pop, lock, and drop. So that's pop the tourniquet, lock the needle, and then go ahead and drop it in your sharps container. And then from there, you would bandage your patient and thank them. And so that is how you perform a venipuncture procedure.